Through a network of state-of-the-art clinics and a commitment to patient-centric care, Zeno Health aims to improve health outcomes and promote well-being in communities. Listen into this episode of Builders for Bharat to understand how Zeno Health is simplifying healthcare for Bharat.
I think Bharat is a very, very big opportunity, especially in our case, in the industry we are operating in, which is healthcare in India. There are many industries which are really focused and are phenomena of metros, or if you say IT, then it is really concentrated to some geographies. But if you say healthcare, healthcare is for people, right? And you have 150 crore people, 140 to 150 crore people in India, and they are all not in metros. Predominantly 70% people stay in Bharat. So, and as you go deeper into Bharat, healthcare becomes less and less accessible, right? So the opportunity is really multifold when you are really serving Bharat, and it is a real need, and that is why the opportunity is there, because the accessibility of healthcare is low there. And in that, when we come to our industry, which is predominantly, as we started, the first step of healthcare is medicine. The Indian public expenditure is really low. It is only 2% of GDP. And if you do it per capita, it is even lower when you compare India with Bangladesh. So government, even with all its might, is only able to serve very, very less in this share. 70% of the cost of the healthcare is borne by the people. And as you go deeper, it becomes even worse because the access is less. So the opportunity is immense for us. One of the first big win is that when we realized that there is a real gap between knowledge of people that they are consuming generics and they are being sold as brand, we started first store in Bombay and educated people and helped them save 80% on their medicine bill. And that was the first step which we took. And in continuation to it, now we have served 25 lakh consumers, is a very, very big win for us, just in 2 cities. And we have saved more than 800 crores in last 7 years to these people. This is another big win for us. In this journey, when we started, we knew that the kind of medicines or the kind of quality we want to really control, we will make sure that we have the whole process. So another big milestone for us was in 2021 when we had launched our own brand of medicine, Good Aid, which we launched in 2021. And we started only with 25 products. So before that, we were selling generics from reputed companies like Cipla, Zydus, Biochem and all. But at that point, we started our own brand and taking control of the whole quality process and getting it from manufacturer to consumer. That was one of the very, very big milestone in our journey, that in 2021, we launched our own brand. The second milestone came when we reached 25% of our revenue, which comes through our own brand now, and 45% of volume, which comes through our own brand now. The third, I would say, milestone is we are always working on that what should we bring for consumer, which is really democratize healthcare for them, or in our case, the medicine cost or the pharma cost for them. The another milestone has come recently, 2 to 3 months back, that in Good Aid, we have launched insulin for consumers. Right? Insulin is very, very expensive for people. They are taking a lot of medicine for their diabetes, but insulin has always been branded very, very expensive. So we are the first company who have launched insulin as generics in India and have provided 50% saving on insulin to people. And it is still really growing, and we are really impacting thousands and thousands of lives with the lesser price insulin in that sense. In our industry, I would say there is a wide space or very, very big gap, which I see from any other industry is, all other industry works for the consumer, right? They will keep on identifying, bring on transparencies, making life of people better and better. But in healthcare, somehow, they do not educate consumer, and that is how they make money, right? This is a very, very big space where people or the industry, because consumer is unknown, trying to mint money because of the unknownness of the patient or consumer. That is what we see as a very, very big space that, and if I translate it to medicine, that people are not aware that what they are buying is generics, and companies are taking the advantage of making a brand over a generic and selling it at a much, much higher price than what it essentially cost or could have been sold to consumer. So this is a very, very big space which we see that if any company stand with the consumer and particularly in pharma and educate them and sell them generic as generics can help them really save big money into it. That is a big space which we see that pharma and we extrapolated it also. We believe that pharma is at a point of inflection in next 15 to 20 years. The whole industry will move from significantly move from branded towards real generics. And there are core three reasons which will drive it. The first is that the people are becoming more and more aware. So they are really opting for alternatives. They can now search, use a lot of tech to identify which molecules they are taking. The second is medicines are becoming more and more expensive. So they are forced to look for an options. And the third is the government is also pushy about generics. So all these three will form this socio-economic impact, the political impact, all this form a system where we will have a very tectonic shift towards generics. And in that space, people will need an entity whom they trust, like they trust a doctor. And that is the space which we are creating. That is the company which we are creating, which people will trust on their medicine. If they want to buy paracetamol or vildagliptin, they won't go to their regular chemist. कि यार मैं शाम chemist के पास जाके ये दवाई नहीं लेता हूँ. They will need an entity whom they trust. And that entity will then bypass everybody from the chain, get it from manufacturer to consumer and provide them the highest quality at the best of price is the future of pharma. And that is the space which we are capturing. I think the acceptance level of generics as a generics is really hard, even in metros. And I think even if you go into tier 3, tier 4 cities, even it is going to be slightly harder because in metros you have a lot of information which is available with people. But in tier 3, tier 4, their information is less. The people getting courageous to know more is a lesser phenomena. So tier 3, tier 4, I think it is a really hard problem when it goes into that. But on the other side, it is really the need more in tier 3 and tier 4 because medicine prices are same. But if you see the household income of metros or urban population and household income of a rural population, it is going to be very different. So the percentage of if you see in percentage of household income, it is going to go much higher into the rural or non-urban India. So the opportunity is very high. I think the problem statement is similar to educate even in metro or to educate even in the tier 3 or tier 4. And for that only, because it's a harder problem, we believe that it is not going to solve just on the online. You need some physical presence, maybe a store, maybe a person who educates them. And that is the only way that you can really crack this piece. So the opportunity is high. The problem is still very tough and maybe slightly tougher than the metros. I think it is a very, very important model. If you see, as we spoke, that there is a very big opportunity which is in Bharat, right? Metro is like very limited population. Bharat is like 70-80% of the population in India, or even more. If you want to reach those population, the micro franchise is one of the channel which we have chosen because that has a potential that it can go to a town of or a small village of 5,000 to 7,000 people also, right? And if you want to really provide access to those places, you need a system which is so cost efficient or a distribution channel which is so cost efficient, then when you want to sell generics, the distribution cost itself should not be so high that the product which you want to sell at a lower price or democratize the healthcare in that terms you are not able to because the cost of distribution is so high. So that is where we realize that for cities, definitely the stores and make sense. But if you go tier 3 and beyond, you really need some innovative distribution channel where the cost of the distribution channel is low so that you can consistently provide the price advantage or the savings to consumer which is intended for them. So we believe that if you really want to impact Bharat, it will just not be the store channel. There will be multiple channels which you will have to work for. And one of the channel for us we trust is in micro franchisee because there is also a relation. The micro franchisee is like a community partner. And in that community, that guy has an influence. That guy can educate because there is a twofold problem. There is an education and then there is a distribution. So education is also required. And we believe being micro franchisee and a part of that community, that person will be able to really educate those people. Once they get educated, they want to make choice along with their doctors for sure, this person can again give a very low cost distribution to provide those medicines at their hands. So we have a very high trust that for tier 3 and beyond, a model like micro-franchisee will really be very impactful. We do not intend to compete with the local pharmacies, right? That is not the intent how we started also. What we are standing for is really educating the consumers that there is an option of a very, very high quality generic brands. They can take generic as generic, which can provide them a lot of savings. Once we educate those consumers, those consumers comes to us, right? And that is the whole intent for us. That if they feel that we are really providing them the best quality medicines at the best price, they will choose us. And that is where the competition comes in, right? But the intent is not that I'm going to take consumers from any other store. It is a byproduct of what we do. If they come to us and they realize that year-old medicine shop has not given them, or year-old tie-up which they have with their own chemist has not given them the benefit which is available to them, they will naturally trust us. And that is the demonstration which we have seen in Bombay also. For last 5 years, 5 to 7 years we are here. And now we are serving more than 3 lakh consumers a month or nearly 5 lakh consumers a quarter, which have been with a lot of other people. And once they join us, they really don't go back because we work on the consumer side. And that is the first thing which they experience when they come here. And that is where they really don't go back to their previous store. If the previous store is giving them the highest quality medicines at the best of price, it is okay for us because we stand for democratization, but we see that it is not possible. The second thing is, when we forecast it for a longer term or when we project it 10 to 15 years, what will happen is people natural tendency will be that they want to transact with organized players. So the organized player are going to come. The other thing is that if you want to really manage this quality controls and all, it will become harder for the mom and pop stores. So currently what we do is this, but I see as a natural progression that because it is going to go organized, as well as the generic quality needs to be really be top notch. It can only happen when there are companies on the backside. It is very hard for the mom and pop to generate that trust. So it will be a natural alignment also in the future that people will start with transacting with the brands of the store, not of the medicine in future. And that is what we are building. It is quite a challenge. I mean, people are taking medicine for 20 years in their life. They are really, it has become part of their daily routine, I would say. It is tough, but there is an intent that people are looking for options, right? If it is becoming more and more expensive, even they are associated with that brand, they're looking for options, right? And when a player like us comes and give them an option and tell them to please take it to their doctors. So we are not against any doctor per se or any body per se. We are here to really provide choice to consumer. And we also say to consumer that you please go and discuss with your doctor, because it has not been marketed to a doctor, the doctor doesn't know. But if you go and tell that it's the same medicine available from the topmost manufacturer at the significantly lower price, it can help a lot of doctor then agrees. So for us, it is a challenge to first educate, and we really take that effort. And then people in consultation with their doctor exercise this. And we have seen 90 to 95% of people really make this choice. Whoever comes to Zeno is where we are. But it is a challenge, and we are up for it. And we see that it will be a challenge for some time. And when we have a critical mass, then it will become an easier play. So it's a challenge, but we take it and we do it in a manner so consumer also gets the trust reinforced by their doctors also. Our marketing strategies will definitely evolve as we go into Bharat. We are also experimenting now to educate doctors about highest quality medicines which are available at significant low price. And whenever they want to write it for consumers whom they want to, or consumers from humble background whom they want to write high quality but at a lower price, they can do that. So there is another marketing strategy which we are adopting. And as we go into these geographies, we have also seen that this our community partner model, which really does health camps in the societies, where in Bharat there are not very health camps. In metros we definitely see the multiple health camps happens, but if you go into real tier 3, tier 4, very very less health camps happens. And in those health camps, we have a health camp as a pharmacist is there, doctor is there, who educates people about generics. And our strategy will keep on developing. Strategy which were working pre-COVID are not working now. We have keep on changing. So as we enter to market, we keep on changing it. We feel more interaction with consumers, having so the principle is that more interaction with consumers, educating them physically, and educating them through doctors has been working for us, and we will keep on operating on those principles, while the channels, the mediums can keep on changing depending on the location, whether it is metro, whether it is a very interior town of India. The response has always been very, very good in our healthcare programs. We have doctors, a lot of people who have not visited doctor, maybe visited 2 years back and have not visited doctor, and they really don't know if their diabetes is up, if their hypertension is up. They get to know, right? And that is where we generate trust with them as well. So response has been extremely high. We have done more than 100 health camp in a month also in past. So our response has been very, very high. It is a very, very high touch point activity as a health camp. And I see a lot of education also happening in that, and a lot of realization for people in their health journey is also happening through those health camps. In tier 2 and tier 3 cities, I see that not a lot of companies does it. In tier 3 and tier all these cities, even the awareness about their health, check कैसे करना है, क्या चीज़ें check करनी होती है, ये भी नहीं पता होता. So if you do these health camps, that is the first point of awareness which comes. And since ऐसा कुछ होता नहीं है वहाँ पे, so when you do that, a lot of people really come forward. We have done in smaller cities that when we did health camp, so many people came that we had to do a pre-planning of 7 days. That we in 7 days said कि यार इन्हीं घरों में हम अपना and we do it by invite now. That we invite these families, these societies, and have a health camp 7 days after. And after invitation only, वो invitation के साथ ही आता है. And now we are making passbook also. कि आपके जो health parameters note किए उसकी passbook किए हैं. And then there is a next health camp which is going to come after 2 months, let's say. And the same passbook people will bring. And this is very, very powerfully happening in the tier 3 and beyond I think, क्योंकि वहाँ पे इस तरह की चीज़ें होती नहीं है. So it really creates impact, and we have seen a lot of, I would say in our times, acquisition has happened through these channels, which has helped them to really understand their health, to really know the knowledge of generics and exercise options on their healthcare.